Hi everyone, welcome to Center of Balance. I'm Sinan Puan from Center of Balance, the acupuncturist. Now, today's topic, we're going to talk about hot flash treatment. We're going to focus on hormone replacement therapy, which is the Western medicine treatment. Not gonna talk about Chinese medicine treatment yet, but yes, tomorrow we're gonna talk about Chinese medicine treatment for hot flush. Now, before I really start this topic today, I'm going to share on my Facebook, and I would like you to do the same. Share on Facebook. Thank you. Let's have a look. Page. So you're on Facebook, please click please say hi to me and give me a thumbs up, and as well as share this live video. I'm going to share this live video on Facebook, and if you're watching the replay, you probably want to turn it make fast forward to start from 3 or 5 minutes, because I'm going to spend some time to share on this video. Oh, okay, yep, I've got it. Then I'm going to go to Instagram, and that's my personal account of Instagram to start the live video as well. Okay, now it's funny, I've seen that some people leave comment in my I got a notification pop up on my Facebook cell phone Facebook that say that one of you, I wasn't sure who, leave comment, but it's funny that I couldn't see it in my Facebook and here. Just so funny. So I'm not sure. Yeah. So I couldn't see your question. Yeah. But anyway, you asking about the skin issues, hive that I suffered from. Yes, it was last week. Yeah. It took about 24 hours to get rid of all of it. I had acupuncture, had Chinese herbs. Okay, and I will share. I got some picture, and I'm gonna make a vlog to show everyone how I actually get rid of it. Okay, it's within 24 hours and everything's fine. And thank you for all your support and care. Thank you very much. Okay, let's start the topic today. We're gonna focus on hot flash treatment. Right, hot flash treatment and hormone replacement therapy. Okay, so the popularity of hormone replacement therapy has won over the years. The reason that people don't want to use hormone replacement therapy to treat hot flash. It used to be quite popular, As more and more people know and understand that hot flushes is causing by the hormone imbalance, and once you use the hot hormone replacement therapy, and it may cause cancer. So if it's not necessary, people just live it. They learn how to live with hot flushes. Okay, so this is the main reason. So treatment with synthetic hormones may be an option for some women who hot flushes are debilitating and greatly affect the quality of their life. Right now, if you haven't got if your hot flush are not as bad, you probably get it once a week, 2 or 3 times a week, or when it happens is just few seconds, you won't want to use synthetic hormone because the side effect of it doesn't make sense. That is why the popularity of hormone replacement therapy is getting less and less and less. It decreases because people understand it. Right? So what are the hormone that we actually use in hormone and HRT? HRT means hormone replacement therapy. Is the estrogen. So it's estrogen supplement level out the amount of estrogen in your system, reducing the incidence and severity of hot flushes and night sweats. But simply just taking estrogen, it may cause problem. So estrogen is usually taken with progestin to reduce the risk of developing endometrial cancer. Well, now you know. So normally combine the other hormone and take it together. Now, how do you take it? It can be taken by pill or through a vagina cream or a patch. Well, I've seen people when they come for acupuncture and they put a patch in there. So what it is? They tell me, oh, this is the hormone therapy, replacement therapy, and then I know, oh, okay, this is the patch. Some people put on the tummy. Some people put on the hand. More often I see it on the tummy. Okay, and it can last for a few days. Okay, so really, whether you want to use hormone replacement therapy or not, you need to understand the side effect first, and whether how severe of your hot flush that impact in your life. Does it make sense? I'm not here telling you, hey, do not use it or blah blah blah, because hot flush it does impact in your life. It depends how serious is the problem. I've seen patients that use it, fantastic results. I've seen patients that use it decreases the hot flush, and I've seen patients that use it that cause other problems like cancer. So you really want to think about it. I'm not here to make the decision for you, but I'm here to give you the information that there has a side effect of it, so you really want to think about it. You know, if your doctor hasn't discussed the side effect with you, and you want to discuss it with the doctor, and you want to find more information and read it yourself, does that make sense? Right. So apart from hormone replacement therapy for hot flushes treatment and Western medicines, and there are other medication as well. It's called non-hormonal treatment, which means we know when it comes to hot flushes, when it comes to menopause, it's the hormone out of balance, right? But in some cases, you don't need to go treat the hormone. Why is that? You treat the trigger. Let me give you an example. We know that the trigger, one of the biggest trigger is the stress, right? Stress, depression, anxiety, and their emotional out of balance will trigger hot flushes as well. So therefore, there are some medication like antidepressant, right? Like Prozac, probably the name of it. They patient take antidepressant. When you take the antidepressant, you become more calm. When you're more calm, it slows down, and you're not as stressed, not as anxiety, depressed. Therefore, it actually helps to decrease the frequency of hot flushes. Does that make sense? So it's controlling and avoiding the trigger, the hot flushes triggers, then to lead to help with hot flushes. Does that make sense? And there are other drugs as well. Gabapentin is usually given for nerve mediated pain or seizures. So some drugs that use on seizures, they found that it actually reduce hot flushes. Okay, so those are some medication that are usually used for hot flushes. One is hormone replacement therapy, the other is non-hormonal treatments, and Western medicines. Those are common ones. And if you're an acupuncturist, then you know your patient suffer from hot flushes, and they will tell you what they're taking, what has been helping, what has not been helping. Okay, so to be honest, I'm not so agree with hormone therapy, and I think there are more things that you can do other than that hormone therapy, right? So what other things that you can do, such as acupuncture? And we have research talk about acupuncture, how acupuncture help the study, and Chinese medicines, and what else? Lifestyle changes. Lifestyle changes means you may be able to do some emotional daily practice, meditations, or change your diet to decrease your hot flushes and eventually stop hot flush. Right. So we're gonna talk about acupuncture and Chinese medicine point of view to stop and decrease hot flashes tomorrow. That's the treatment we'll talk about. Then we also want to talk about in another day about what sort of diet can actually help you decrease hot flashes. And a lot of people have tried it and it works very, very well. And I want to share with you. This is how I share with my patient as well. Alright? Stay awesome and I'll see you tomorrow. Bye bye. Hi Veronica, how are you? I'm good, thank you. I'm good. So thank you very much, everyone.